Hi guys, now we talk about celiac disease. It's a malabsorption syndrome. Means clinical feature is steatorrhea. It is mainly due to gluten sensitivity. Antibodies are developed against gluten. It is associated with HLA DQ2 and DQ8. It affects the second part of duodenum. How to remember? Celiac, C. C looks like second part of duodenum. So it affects the second part of duodenum. Now the important features. In histopathology, there is villous atrophy. So, defect in transepithelial transport. Okay. And there is crypt hyperplasia. Increase intraepithelial CD4 8 plus cell in lamina propria. So, the histopath picture is, this is the healthy mucosa, intestinal mucosa. So, these finger-like projections are villi. But here the villi get atrophied. Here the villi get atrophied. Villous atrophy happens in celiac disease. Various food contains gluten like wheat, barley, oats, rye. Bro, B-R-O-W, B for barley, R for rye, O for oats, W for wheat. So you should not eat these 4 items: wheat, barley, oats, rye. The diagnosis is made upon intestinal biopsy and some antibodies. There are 2 antibodies. One is IgA tissue transglutaminase antibody. These are the most sensitive antibody, but the anti-endomysial antibody is the most specific antibody. So most sensitive antibody is tissue transglutaminase. It is a IgA antibody, and the most specific antibody is anti-endomysial antibody. Okay, and celiac disease associated with T-cell lymphoma, most associated carcinoma with celiac disease, and it is associated with iron deficiency anemia. As it is malabsorption syndrome, so there is iron deficiency anemia, vitamin A, B12 deficiency, and celiac disease associated with dermatitis herpetiformis. This is very important. Okay, and celiac disease may be associated with adenocarcinoma of small intestine. So we can quickly recap it. Celiac disease. CD4 8 plus in lamina propria. There is villous atrophy. So defect in transepithelial transport. There is crypt hyperplasia. And management is don't eat wheat, barley, oats, rye. So bro. And there is one grading for celiac disease. That is Mars grading. You have to know just the name. Okay. Mars grading. And diagnosis made upon intestinal biopsy and 2 antibodies. That is IgA tissue transglutaminase antibody. This is the most sensitive antibody, and anti-endomysial antibody, that is most specific antibody. Celiac disease associated with T-cell lymphoma. It is the most common associated carcinoma with celiac disease. Iron deficiency anemia, vitamin B12 deficiency, dermatitis herpetiformis, and adenocarcinoma of small intestine. This is all about celiac disease. So see you in next video. If you like this video, please like, comment, share and subscribe. Tata.